Hello, good afternoon, everyone. My name is Jeanette Moreno, and today I'll be presenting on how chronic stress affects the body. This topic is especially important in the field of nursing because stress doesn't just affect our emotions, it changes how our body functions. And as nurses, understanding how chronic stress impacts systems of the body helps us provide better care, promote prevention, and educate our patients on managing stress. Stress is a normal reaction that prepares the body to handle challenges. However, when it becomes chronic, meaning lasting for long periods of time, it can harm both physical and our mental health. According to the American Institute of Stress, in 2023, about 77% of people regularly experience physical symptoms of stress, and 33% report feeling extremely stressed daily. Chronic stress affects key systems like our nervous system, the endocrine system, immune, and cardiovascular systems. Today, I'm going to break down how these systems are affected and why recognizing chronic stress is critical in nursing practice and some ways that we could try to prevent or help individuals with chronic stress, and not just individuals, but ourselves. Um, the body stress response begins in the HPA axis, the hypothalamic pituitary adrenal axis. When we receive a threat, the hypothalamus triggers our pituitary gland to signal the adrenal glands to release cortisol and adrenaline. These hormones increase our heart rate and our blood pressure and our blood sugar. It helps us respond quickly. In short term situations, this is helpful, but when stress becomes chronic, cortisol levels stay elevated, and over time, this imbalance can cause damage to our organs and disrupt our normal body functions. Chronic stress keeps the sympathetic nervous system, our fight or flight system, constantly activated. This leads to anxiety, sleep disturbances, headaches, and irritability. Research shows that prolonged stress can cause the hippocampus, the part of the brain responsible for memory, to shrink up to 8%, while the amygdala, which processes fear, becomes overactive. These brain changes contribute to mood disorders like depression and make it harder for the body to relax and to recover. The endocrine system, which regulates hormones, is strongly influenced by stress. During the chronic stress, cortisol levels remain about 20 to 30% higher than normal. Elevated cortisol disrupts blood sugar balance, leading to fatigue, weight gain, and a higher risk for type 2 diabetes and hypertension. Stress also interferes with other hormones like thyroid and reproductive hormones, which can affect metabolism, mood, and overall energies. Chronic stress, these are ways that chronic stress affects the immune system, which when chronic stress weakens the immune system by suppressing the white blood cell activity, people under long-term stress are twice as likely to catch a cold or infection. At the same time, stress increases inflammation, which can worsen autoimmune disorders and slow down natural healing processes. In fact, wound healing can be delayed up to 40% individuals experiencing chronic stress. And this is such important information for nurses to know because this affects how our patients heal if they have like a lot of chronic stress in their life. So, nurses understanding this helps us recognize that delayed recovery might not just be about medication or treatment, it can be about emotional stress too. And I have a body illustration to see how and what organs in our body and how are they affected. Like the skin, we could have eczema and skin rashes. Obviously, our suppressed immune system. We could have digestive issues. We could have ulcers, IBS. Um, Obviously, for our mental health, we could have anxiety, irritability. Um, we can suffer from headaches and just mood swings. And obviously, for our pancreas, we could have increased insulin secretion, high blood sugar, which can lead to type 2 diabetes. Um, and it also increases the risk of breast and ovarian cancer in women. And it also decreases the chance of women being able to get pregnant. The cardiovascular system is especially sensitive to stress. Chronic stress causes continuous activation of adrenal and cortisol, which raises the heart rate and blood pressure. Over time, this damages blood vessel walls and increases the risk for hypertension, heart disease, and stroke. Studies show that people under high chronic stress have 40% higher risk of developing hypertension and are more likely to experience heart complications. This connection is one of the main reasons why management is a vital part of patient care for those with heart conditions. As nurses, we're in a key position to recognize and manage stress in both our patients and ourselves. We should assess for stress related symptoms like fatigue, poor sleep, or frequent illness, and provide health teaching on coping strategies. Evidence based interventions include deep breathing, mindfulness, physical activity, and social support. Educating patients on these techniques not only improves recovery, but also reduces the risk of chronic diseases linked to stress. Managing and reducing chronic stress. Managing and reducing chronic stress starts with restoring balance to both body and mind. Lifestyle changes such as regular exercise, a balanced diet, and proper sleep help regulate cortisol and reduce inflammation. Mind body techniques such as deep breathing, mindfulness, yoga can lower heart rate and improve emotional regulation. Encouraging time management, setting healthy boundaries, and connecting with supportive people are also vital. As nurses, we play a key role in teaching patients these coping skills and promoting long term self care to prevent stress related illness. And these are very important skills that we can also um, use in our lives as nurses because, as we know, nursing is and can be a stressful job. So it is very important for us to be mindful that these things can help us to help ourselves and be better nurses or patients. In conclusion, chronic stress affects nearly every major body system: neurological, endocrine, immune, cardiovascular. According to the American Psychological Association, up to 60 to 80% of doctor visits are stress related conditions. As future nurses, it is our responsibility to recognize these signs early, promote healthy coping strategies, and provide holistic care that addresses both physical and emotional health. Thank you guys for listening. I hope you enjoyed my presentation on how to manage chronic stress. Here are my references. If you know anyone or yourself, if you're struggling with chronic stress, these are good. These are some wonderful references to help you cope and learn a little bit of ways that it can affect you or affect a loved one or someone that you know and how to help them. Thank you.